Hi everyone, I'm Samora Maranya, an orthopedic fellow at Dalhousie University. I'll be showing you the arthroscopic hip labral repair. This is designed for those who want a behind-the-scenes look at real surgical techniques. Indications for arthroscopic hip labral repair include labral tears and cam deformity. If left untreated, these may result in progression of hip osteoarthritis. Abnormal separation at the contralabral junction and labral tearing is identified, and the degree of delamination assessed using a probe. The drill and guide are placed on the acetabular rim with an on-fast view. This is continued with an inside view to prevent cartilage injury. A single loaded anchor is then placed through the guide and a suture passer used to pass one limb of the suture through the labrum. This limb is retrieved and pulled out of the joint. A knot pusher and needle driver are then used to make a revo knot, with the knot placed on the non-articular side of the labrum. This rolls up the labrum and fixes it to the acetabular rim, completing the repair. An on-fast view shows the repair with the restored suction seal. Thanks for watching.